What is up, guys? Welcome to another video on my channel, Hairliciously. I hope all of you guys are doing great. So today I actually wanted to talk about one of the more important topics discussed when it comes to hair transplants, and that is about density. Two of the most common questions that I get regarding hair transplant density is if a person can actually achieve the same density that he or she had before they suffered from male pattern baldness, and the fact that they want to know if they can actually achieve a maximum density through a hair transplant. Now, these two are going to be great questions because when it comes to density, a person needs to get adequate density to make a hair transplant look natural and obviously dense. So someone who's actually not suffering from male pattern baldness or hair loss has anywhere from 80 to 100 follicular units per centimeter squared. And obviously this is going to be dependent on each person based on ethnicity, their genetic makeup, their hair characteristics. Around 80 to 100 follicular units per squared centimeter is roughly going to be the average of somebody who's not balding, and that is actually equivalent to about 150 to 200 hairs, which include 1, 2, 3, and 4 hair grafts. And most hair transplant doctors try to achieve a density of anywhere between 40 to 60 follicular units per centimeter squared because people who are thinning from hair loss, it's not usually going to be visible until they lose about 50% of their native hair. So if you have anywhere from 80 to 100 follicular units per centimeter squared and you're not balding, that'd be about 40 to 60 follicular units per centimeter squared. And that would be enough to create a density where it's going to create an illusion of a full set of hair. Now, I kind of want to touch upon the topic of an illusion of a full set of hair because there's going to be other factors that will determine whether, this 50% hair loss or hair density is going to be adequate. There's other factors that include things like hair characteristics, hair shaft diameter, which can obviously affect in attaining the illusion of coverage. But in general, generally speaking, anywhere from 40 to 60 follicular units or grafts per centimeter squared should be enough to create an illusion of a full set of hair. And when it comes to density, there's obviously going to be people who want to achieve a higher density, and they want to see if they can go beyond the 40 to 60 follicular units per centimeter squared. Usually it's a case where people are suffering from a less severe form of hair loss, such as a Norwood 1, 2, and Norwood 3. And obviously people who are on the lower spectrum of the Norwood chart can have more leeway because of the fact that they're not suffering from a severe form of hair loss. They can actually have more coverage and add in more density to the areas where they're actually suffering from hair loss. And as a result, they want to dense pack the hairline or whatever regions. And so if you guys look at this video here, it shows a person getting a hair transplant where grafts are extracted via FUE with an automated punch, and then it's carefully implanted using what is known as a Choi implanter pen. So instead of making slits on the recipient area, each graft is going to be loaded into this pen device, and it's going to be implanted into the scalp in one setting. So this reduces trauma, it's going to reduce blood loss during the hair transplant, and it can result in a faster healing time. The other pro is that these grafts can also be positioned in the proper angle and direction with greater precision. And this doctor proceeds in implanting 100 grafts per centimeter squared. So he actually drew it out on the scalp to go ahead and illustrate that he can actually implant 100 grafts per centimeter squared, which is obviously the density of somebody who is not balding. So technically speaking, yes, it is possible to achieve such a high density through hair transplantation, but many doctors are not going to do this for a variety of reasons. So number one, it's really not necessary for you to get a full density of, anywhere upwards to 100 grafts per centimeter squared to get good coverage, because like I said earlier, if you are able to just provide 50% coverage, it's going to create an illusion of a full set of hair. And number two, it's going to waste finite number of grafts. Obviously, we don't have, infinite number of grafts in the back of our scalps, which you can use later for further hair loss. So we never know when we're going to, continue to suffer from hair loss. We don't know how many grafts we're going to need in the future. So due to the fact that it's going to waste finite number of grafts, a lot of doctors are kind of against it. And number three, implanting at this density can overwhelm the blood supply in the scalp, and it can result in shock loss in the surrounding native hairs, which means that the higher density that you try to achieve, the higher the chance that the grafts, or at least not all of the grafts, are going to survive. And number four, like I said, severe damage or diversion of the scalp blood supply can potentially cause necrosis or other serious complications in the scalp. So many patients will go in for a second procedure, as in the case of mine, to go ahead and increase their density since most doctors are going to be more on the conservative side, they're going to only implant anywhere from 30 to 50 grafts per centimeter squared during the first procedure, due to, obviously the things that I mentioned earlier. And they don't want to overwhelm the blood supply and result in a higher rate of hair loss. So in my case, I'm actually going to go in for a second procedure later this year, to add on to the density to the hairline and also to lower the hairline just a little bit, because I still feel that it's a little bit high. I still haven't decided on the specific date of when I want to go. But I do have a wedding towards the end of October, so I'm not going to be able to go anytime before that, because as you guys saw in some of my previous videos, when I had my first procedure, the scalp was pretty red on the recipient zone. And so obviously if I do get it before the wedding, the photos are going to show the redness. So I'm trying to go after, but I'm definitely going to go later this year to get my second procedure done. And I'm actually looking very forward to getting the density, because part of the reason why I really didn't like growing out my hair was because the lack of density didn't give me good coverage. I know that in some of my older videos, I told you guys that I'm going to grow out my hair, I'm going to try different hairstyles, and I'm just going to grow it out so that I can cover the forehead and just put down the hair. But it really didn't work out, because every time that I did put down my hair to cover the forehead, it actually didn't cover, there just wasn't enough density to cover the forehead. And I just didn't have the density needed to be able to style my hair in certain ways that I wanted to. So hopefully the second time I'm going to be getting a better density into the hairline. I'm going to lower it just a little bit. And then in some of the temple areas on the sides, I kind of wanted to get it filled in because it just looks a little bit more receded. I kind of wanted to make it a little bit more straight, but not too straight. And hopefully I'll be able to do different types of hairstyles. So if I were to put my hair down, you guys can see that on the right side, it actually does a good job of providing good coverage. But on the right side on the right side, but on the left side is where the density is kind of lacking. As you guys can see, it's kind of giving me that see-through appearance where the density is not fully there. That area right there versus this area here where it's obviously a lot more dense. But like I said, hopefully after my second procedure, I'm going to be able to style it a lot better. So in conclusion, yes, it is possible for somebody to achieve a density of that of somebody who is not balding. But like I said, it really depends on your situation, your circumstances. The thing that I wanted to kind of address is the fact that if you are suffering from a minor form of hair loss, and let's say you're like a Norwood 1, 2, or 3, and you're at an age where, hair loss has somewhat been stabilized. You're not like in your early 20s or early 30s. I think going in for a second procedure to add in density can be something a lot of people would want to do. But, like I said, provided that you do break it down into different sessions, at least 2 sessions where you can actually add on to the existing density instead of just one procedure where you just overwhelm the scalp and the blood supply, where it can cause further hair loss. So if you are in your 20s, early 20s, or even your mid 30s or early 30s, and you have somewhat of a hair loss that is more moderate to severe, I'll be cautious when it comes to achieving a higher density, because it's going to be a risk. Hair loss can start and resume at any age. Just because your hair loss stabilizes when you're in your mid 30s or in your mid 40s doesn't mean that it's going to stop and, not progress. So it's a gamble, and with the finite number of grafts that we do have, we have to really be able to be resourceful and allocate these grafts and be considerate of future hair loss. But like in my case, I feel like I don't have that severe form of a hair loss. I'm 30 right now and taking Propecia, and I'm taking precautionary measures to make sure that my hair loss doesn't progress further. And so hopefully I'll be able to add in more density, be able to create a more natural looking hairline through my second procedure. But thanks for watching, guys. If you guys like this video, give it a thumbs up. If you guys have any questions, make sure to leave me some comments below, and I'll talk to you guys next time. Take care.